Do I need testosterone replacement therapy? This is a question I get asked a lot from both males and females trying to better understand whether or not it's appropriate for them to take testosterone replacement therapy. So, what I would suggest is, what is meant by need? Is this based on symptoms, what somebody told you their symptoms were, and you think you have that too? Is it based on lab numbers or all of the above? Um, Symptoms can be helpful in helping us understand that, but what symptoms raise the most clinical suspicion about low testosterone and the need for testosterone replacement therapy? My name is Dr. Terranella, and in this video, we're going to explore these questions and others that are going to help you understand whether or not you need testosterone replacement therapy. It's not necessarily geared towards males or females, it's just a general topic of testosterone replacement therapy. Both males and females can benefit from testosterone replacement therapy. So we're going to explore this question and others, and the answers or the sort of background here is based on my 10 plus years of clinical experience treating hundreds of people with low testosterone, and also, of course, based on my medical training in hormone replacement therapy. So to help us with this question, I suggest you try to answer what makes you interested in looking at this as a potential treatment for yourself. Now, for some people, it's, friends talking about it, sort of told them how much it helped them. Other times people are just searching on the internet what, symptoms may be related, or do I have low T, and you take a quiz or something like that. And all that's good. It's great to be well informed about what's going on in your body. But first, though, I suggest we take a step back here and look at what other things might be causing those symptoms. We don't want to get too focused on, just one thing. So to do that, first we want to look at what the symptoms are of low T. And these can be like fatigue, low motivation, decreased mood and or anxiety, low libido, erectile dysfunction, decreased exercise tolerance. So you can't work out as long or can't use heavy weights. Increased weight, specifically around the abdomen, could be a sign of low testosterone, or increased abdominal fat. Could be a sign of low testosterone. So all these things could be, signaling that, maybe you do have low testosterone. Also, you may not have that same executive decision making. You're sort of slow around making decisions, or difficulty coming to a decision, or get overwhelmed in the presence of, lots of information, foggy memory, or slow recall. All these could be signals that your body is deficient on testosterone. But what else could be causing these symptoms? Certain vitamins like B12 and folate could mimic similar types of symptoms, or even iron all could be have those same exact symptoms. Now, they may present a little bit differently, but you could have those symptoms. Other hormone deficiencies like thyroid or cortisol could cause that as well. High stress and poor sleep, that combination of, not sleeping a lot, and when you wake up, you're just sort of really stressed out, stressful time, or maybe that's just how you operate. Those things could present like, foggy thinking and all those things. And part of that may be its influence on your other hormone levels too. Also, sometimes digestive issues and poor absorption of certain nutrients, like, the nutrients I already explained, but also zinc and magnesium and even protein, amino acids could be influencing could be creating some of those symptoms too. And then just having, any chronic health issue could give you some of these symptoms, autoimmune issues, cardiovascular issues, all those symptoms could, or all those conditions could be causing some of those symptoms. So we don't want to get, too focused on, oh, it's testosterone, let me just check and see, and then start it. So before I consider starting someone on testosterone therapy, I always evaluate whether or not they have those symptoms to help understand whether or not it's going to be safe for them to take, what kind of dosing we might provide, and also, is it overall going to be, supporting their health or potentially, making things worse. So it's important to, kind of keep those things in mind. So there's a couple other things I think are important when considering, evaluating someone for testosterone replacement therapy. It's not just about labs. So the testosterone replacement therapy doesn't start and end with laboratory results. We want to know your age, your symptoms, what medications you might be taking, excessive alcohol intake, or other substance of abuse like marijuana, opiates. These may be medications that you take as prescribed, or it may be something you're abusing. But in any case, those types of things. Certain medications can impact your testosterone levels and may be, the actual cause for it. Now, that doesn't mean we wouldn't use testosterone in the case that you're on those. It just sort of helps inform us, well, why is it like this to begin with? We don't need to go looking for other reasons if, there's an obvious one. Certain nutritional deficiencies can also impact your body's ability to make testosterone. So each and every one of these provide information about why your testosterone levels are the way that they are, and potentially can provide a way to correct them as well. So we don't want to just look at the labs. We want to kind of put it in the clinical context of your health. And then symptoms of testosterone. So if you have low testosterone levels, but you don't really have any symptoms of low testosterone, it may not be worth even taking testosterone. So I say maybe with a little caveat, because sometimes people don't really know how bad they feel until they feel better. They don't identify with the idea that I'm fatigued. They might say or think, well, I get a lot of stuff done during the day, or, I'm functioning, above my peers or whatever. But it's sort of relative to how easy that is for you. It may have been, 50% or 25% easier, 10 years ago or 5 years ago. So it's, sometimes people don't realize that they weren't feeling great until they feel better. I find that happens on a fairly regular basis. So I thought it important to mention. And then, with that too, about 1 in 4 males that have low testosterone don't report any symptoms. So you may be one of those. But in the case that there's really not any improvement in testosterone or any improvement in your symptoms or how you feel, then it may not really be worth taking it. I mean, I wouldn't necessarily just take it just to take it. Because there are, some side effects that can go along with taking testosterone replacement therapy. And, to kind of see the reverse side, there are some, benefits, metabolic effects, metabolic benefits that may be important to look at as well if you have, like metabolic syndrome, blood sugar issues, diabetes, high blood pressure, these types of things. There may be more benefit than there is risk to taking testosterone. So you have to kind of weigh all these things. And also depends, with the labs, just how low your testosterone is. Is it under 450 or is it above 450? That's kind of my cutoff for the total, at least when you don't actually have symptoms. Those are some things that I think about. But overall, I like to see, there should be some measurable benefit that outweighs any risks that might be present, which, the risks are pretty negligible, but there are some risks I'm not going to get into here. Hey, I hope this video was useful in helping you understand and think about testosterone replacement therapy and whether or not it's going to be something worthwhile for you to look into. If it was, please click on the like button. And there are many other topics surrounding testosterone replacement therapy, like, for instance, side effects, dosing, causes of low testosterone, injections versus creams. I did get into some of that here, but there's more details on it. And if these are things that interest you, go ahead and subscribe to the channel, because I will be posting new videos on similar and related health topics soon. And we will see you next time.